The sensory portion of cranial nerve 5, the trigeminal nerve, mediates facial sensation and the sensory part of the corneal reflex. The motor portion of the nerve innervates all the muscles of mastication. To test the nerve's motor function, ask the patient to clench and then relax his jaw while you palpate the temporal muscles and then the masseter muscles. Note the strength of muscle contraction. The sensory portion of the trigeminal nerve has 3 divisions: the ophthalmic, maxillary, and mandibular divisions. All 3 areas should be tested symmetrically by assessing the patient's sensation of pain, light touch, and perhaps temperature.
I want you to close your eyes.
Explain and show the patient how you will assess for pain. Then, with the patient's eyes closed, test for pain sensation using the sharp end of a previously unused safety pin or other suitable sharp object. Occasionally, substitute the dull end for the sharp one as you test scattered areas.
Sharp. Sharp. Now I'm going to compare side to side. Keep your eyes closed. Is this the same as this?
Then compare symmetrical areas on both sides of the face.
The same as this? Yes.
If you suspect an abnormality, confirm it by testing temperature sensitivity.
Cold.
Again, explain the test first to the patient. Then, with the patient's eyes closed, test scattered areas. If indicated, compare sides.
Cold. I'm going to test the sensation of your face by lightly touching the cotton against your skin. When you feel the cotton touch, I want you to say now. Now, if you'll close your eyes.
Next, test for light touch using a wisp of cotton. After explaining the procedure, test in scattered areas.
Now, keep your eyes
Again,
closed.
compare sides.
Is this the same as this? Yes.
To test the corneal reflex, ask the patient to look up and away from you.
Look to the left and
Now approach the patient from the side, out of his line of vision, and lightly touch the cornea with a fine wisp of cotton. Normally, the patient's eyes blink and tear, but a contact lens wearer may have diminished or absent corneal reflexes. Cranial nerve 7, the facial nerve, innervates all the muscles of facial movement and expression. It also mediates taste sensation in the anterior 2/3 of the tongue. To assess this nerve, inspect the patient's face at rest and during conversation. Note any asymmetry and look for tics or other involuntary movements. Next, ask the patient to raise his eyebrows, frown, close his eyes so tightly you can't open them, show his teeth, smile, and puff out his cheeks. Normally, the patient can do these maneuvers easily and symmetrically.